This is HealthCall Online, the place for extended versions of interviews you hear on our weekly radio broadcast, the HealthCall Radio Hour, now heard on more stations around the country through national syndication. So I'm glad that you're here because, I've learned that over the years of doing this program, people who follow this show are a pretty smart bunch. You already know that heart disease is the leading killer in America, but what you may not know is that Alzheimer's and dementia are also a leading killer. In fact, Alzheimer's ranks number 6 nationwide. There is much we don't know and don't understand about dementia, and if it touches your family, it will really have an all-controlling impact. So let's learn more about what we need to know about Alzheimer's and dementia by talking to Teepa Snow. She is a noted dementia care specialist and the founder of the Positive Approach to Care, and we'll learn more about that in just a little bit. Teepa, thank you for being here. Tell me something that most people just don't know or misunderstand about Alzheimer's and dementia.
One of the biggest mistakes we make is thinking it's about memory problems, when in fact it's about brain changes that will ultimately change everything about you as a human being, and how you appear and how you act and how you react and what you know and how you know it. It's going to change things in so many ways. And we think about it as a memory issue problem, and it's a tiny tip of the iceberg.
Ah, that's good to know. So Alzheimer's is a form of dementia, but not all dementia is Alzheimer's. So explain that to me and what that means as it applies to my family member.
Yeah. And so what we want to think about is a great big umbrella. And the umbrella is the syndrome. In other words, that's what dementia is. It's a collection of symptoms that fit under this umbrella. And we know that there are basically 4 things that are going to be true if you indeed have a dementia. Number 1, at least 2 parts of your brain are starting to actively die. That's an important thing to know. So it's not just damage, it's active death to those parts. The second is that it's progressive. So once it starts, we don't currently have a way to turn off a dementia. And the third thing is that we don't have cures for it. We don't have a way to cure it or fix it or make it stop or make it turn around. And we also don't have ways to prevent it from happening. We have risk reduction, but not prevention. And fourth is that it is a terminal illness. You mentioned that it's on up there. Estimates are for people over the age of 65, it's right on up there like the 4th leading cause of death over the age of 65. If we count everybody, it's a little bit lower, but if we count the older group. So now under that umbrella, we have different forms like Alzheimer's, Frontotemporal, we will have Lewy body, vascular, and a whole bunch of others.
Yeah, we'll talk about some of those in just a second. How is it that Alzheimer's and dementia kills me? How does it take my life?
Well, what happens is it destroys so much of your brain tissue that your brain can't run you anymore because your brain runs everything. And so eventually it will get into the systems that allow you to control how you breathe, how you swallow, how you digest your food, whether or not you can move, whether or not you have any desire to keep going. And so it can affect people in so many ways. But ultimately, it gets to a place where it has destroyed approximately 2/3 of your brain tissue. And when that happens, you just can't keep going anymore. It's just not enough to keep you going.
So the autonomic systems, the breathing and all those things just fail?
They could, or you could not be good at it and you end up with a pneumonia. You could not be good at what we call our sustaining systems. And so you end up with infections that become septic. They get into the bloodstream. Or it could be that the muscles in your body just atrophy and you can't move. And so you end up with pressure areas. So it's not a comfortable or easy way to lose life. And honestly, not everyone goes all the way to the end of their dementia before something else or some complication might. And hip fractures or fractures are a big piece of the puzzle. So falls are always bad.
Yeah. All the risks that come along with advanced age. I get that. We're in the news these days with Bruce Willis and his prefrontal temporal dementia, or frontotemporal dementia. There, I got it right. Frontotemporal dementia.
Well, the tricky part was he started with primary progressive aphasia, so PPA, and then his progressed into frontotemporal dementia.
So what is that, and how is that different from Alzheimer's?
Yeah, so with Alzheimer's, classically, the first symptoms appear deep in the brain in the hippocampal area. Learn and remember, find your way, and keep up with time. And then it spreads in your brain, vision center, thinking center, language center. But with FTD, Bruce Willis's type particularly, it actually started in the left temporal lobe with language. Can't find words, can't understand words, have difficulty with meaning of words. And so the language center was deteriorating. And that's when he had to step back from acting because you have to learn scripts and use words. It wasn't happening. And for about 25% of people who get primary progressive aphasia, it wipes out that center and it stops. It's not progressive past that. But for other people, it progresses. And 75% of folks start having problems in the front of your brain, which is called the executive control center. So it's the part of your brain that allows your brain to make choices that are consistent with your values. It allows you to think things through logically. It allows you to control impulses in what you do or say or look at or touch. It allows you to consider your alternatives and pick one that matches you. It allows you to get started on something, do it correctly, finish it off, and then move on and go do something else. It also allows you to look at yourself and know whether you have skills to do it or you need help. And it allows you to see other people's points of view.
Got it. So with all those things missing, boy, yeah, life is really taking a turn. So understanding what type of dementia I have is important. How does that affect the care that I receive or I should be looking for?
Yeah, so what we're going to need is some special skills for FTD because you're losing communication, but you're also losing sequencing and initiation, and your personality is going to change. You're not going to be how you were before. So, boy, as a family member or as a provider, I need to understand that, and I'm going to be real tuned into hey, and I want to use automatic kind of things, and I'm going to use a lot of ooh.
So a lot of visual cues.
A drink?
Right.
I mean, and so I have to get really good at this stuff. And not all dementias require that skill early in the condition. Late in Alzheimer's, yeah, I will need some of those same skills, but not right off the bat.
Okay. So how do I go about getting that diagnosis? Because I got to tell you, I have been through I've been in the room when neurologists have conducted the screening, and you typically get the 5-word memory test. I'm going to give you 5 words, and then a few minutes later, recite them to me. They manipulate hands on a clock, and, it's pretty rudimentary.
It is. And unfortunately for people with FTD, Lewy body, even Alzheimer's, if I'm smart, I can do that long into my condition. And it's one of the biggest mistakes we have is we don't have good baseline measures. So what classically is going to help in this case is the report from the person about what they're doing and how they're doing it in these areas, and then a report in a private space of a family member or friend who says, I'm noticing some impulsive behaviors, like they're driving the car really fast, or they can't seem to get going, or they've gotten really obsessed about. I mean, she's saying things I've never heard her say, and she's being rude to people. She won't go anywhere. She's not even getting dressed. I mean, so these things with frontotemporal particularly, it's often how I'm not how I've been. And that's important to notice. But we've got to have a provider who's curious too. And that's hard sometimes when you're a family member or you're the person even saying, I'm having problems. Because sometimes people do notice. I can't hold on to words. which is what Bruce was saying, early
Right.
on. This is crazy. I never had this much trouble.
So the diagnosis is really a clinical observation and a judgment from somebody who can recognize the symptoms and the behaviors.
At this point in time, there's clinical research going on to try to give us other ways to really get there, but especially if it's a spontaneous case. In other words, it doesn't have the genetic hallmarks in your family. It doesn't run in families. Sometimes it does, sometimes it doesn't.
Yeah. People typically live anywhere between 3 to 10, 20 years after diagnosis. It's hard to know how long they're going to live. I suppose that's a function of general health.
And type of dementia and things that are going on. So younger people might progress through their dementia very rapidly, but because they have a healthy body, they might live longer toward the later state of dementia, whereas frail older adults with a dementia might actually, their body and the frailty impacts sooner. So it's really complicated to estimate, how long.
Yeah. Memory centers are popping up all over the country, and all of us are going to face this with a family member sooner or later. The statistics are just there that, this thing is going to hit us like a freight train as us baby boomers age into those years. It's coming. So how do I find the right memory care center? What do I look for?
My rule of thumb is, do they have the training and education to provide them with the skill that we know we need? Or do they just say, we're a specialist care center? And it's like, show me what you're doing that prepares your employees and your staff to provide this special support. And they should be able to show and tell you what it is they're doing with people coming in to work there that prepares them to do the special care. Because without it, frankly, they're no better than any other place. And it's really important to know the location and who's there and what their knowledge and skill set is.
Yeah, so we don't want to be just warehousing people. That's not what we're looking for. We're looking for people with skills and abilities to, for example, communicate and help me communicate more effectively. So they should be training me as a family member and caregiver, right?
They should, and they should invite you in. We're looking for places that are recognizing families don't want to run. They want support, and they've gotten to a place where I don't think I can do this 24/7. But I do want to still be part of my person's life. And here's how I really would like to be part. And for some families, it's, I'd like to go back to being her daughter or her husband, or I would like to go back to a place where I'm not trying to do it all. Or for other families, I'd like to come in and have something to do with my person that makes sense. Because filling the day is also something, it's more than just caring for a body or a human. It's how does my life look for me and my family now that I'm here? And people should be able to describe how they're going to engage and how the person is engaged in doing it.
So share some ideas with me. If I'm caring for a dementia patient at home, I almost said victim because, frankly,
I'm glad you didn't.
Well, it's kind of how I feel about it, though. I'm terrified of this, frankly.
Yeah, I get that. But it's really, if we victimize people, then they don't have power. And I want people to feel somewhat empowered to live life, even with a dementia, because the way you are today, you may start missing pieces, but you're still yourself, Lee, tomorrow. So it's like, how can I give Lee a sense of value and purpose?
Oh, let's walk down that path. How do you do that? If I'm having trouble communicating, if yesterday just blends into today with no real differentiation, how do I achieve that sense of worth and being?
Yeah. Ooh, hey, Lee. This one, or this one?
Well, now wait, this is, we got to think beyond the visual here. So the video version, I get that. Can you describe for our radio audience what we're doing here?
Yeah, and so what happened is I took away audio, didn't I? Yeah. And we were doing something visual. So this is the tricky part, is I've got to work with what you still have, not lament what you don't. And so it will be some whole new learning for us. I've got to learn how to use props, and I've got to learn how to use gestures, and I've got to learn to give Lee a lead in. Ooh, hey, Lee. Because whenever you do that, the person goes, yeah, almost invariably. It's an automatic sort of call and respond. And so the better I get at that, I have a favor to ask of you. Now, when I say I have a favor, doesn't that empower you?
Yes, it calls to my spirit to step up and help. I get that. Yes. If I'm dealing with somebody who is obstinate or irascible, I understand that's one of the common changes here is people kind of can turn nasty. What do I do about this?
Oh, you're not liking anything about this. Nothing. Wow.
So validate that behavior. Validate how they're feeling.
Tell you what, let's get out of here for a little bit.
And then what does that mean?
That means we're taking a break from what we're doing right now. Because if somebody's giving me a pushback and I keep trying to push what I want, all we're going to do is have a stalemate. What I opt for is, I heard your message. Not right now. Tell you what, let's take a break then.
Okay, get that.
And now all of a sudden we're on a common page. And now I need to take a breather. And I need to rethink what I was doing because one of us has to change. And I always want you to change. But in fact, I'm the one that has to change first.
Yeah, right. Because we're not going to convince the Alzheimer's patient to change. I get that, right? Yeah. So it's all on us. If a common problem, and I've experienced this with members of my own family, can you take me home? I want to go home. Yeah, and they may not know where they are. They may be at home and say, I want to go home.
Yeah.
What's going on there? How do I get over that?
Yeah, and that goes back to the hippocampal area, which is home is the safe place where we feel comfortable. And what you've just told me is you're not comfortable here. You're not comfortable with me. You're not comfortable with where we are. We're not comfortable with what we're doing. We're not comfortable with the things around us. So I've got to really hear that and say, you want to go home. First thing is a reflection. Yeah. Do you need to do something there? Or you just want to be there?
Okay.
Now I've given you a choice.
Right.
And I'll listen to what you say. So if you say, well, I have things that have got to get done. Well, now I know you were bored and I wasn't giving you enough to engage you. And so you got to do things. Oh, hey, listen, before we go, could you help me with something real quick?
Okay. So don't walk down the path of, well, what do you have to do? What's undone? Don't get pulled into that. Is that what you're saying?
Don't get sucked into there because it's like they may not have the words. What I heard was you need something to do. So I'm going to create an opportunity for us to do something which will engage your brain and maybe I can bring you home a little bit.
Got it. Okay. Talking to you is so interesting. You've obviously been around a number of different patients in your career. Tell me something that you've learned about people in this process that is kind of universal and we can all take away.
Yeah. People want to be heard. People want to be believed. People want to be themselves. And when we can figure out how to support that self, no matter how hard it could be at times, turns out we both benefit. It's just a hard transition to let go of what I can't have and celebrate what's possible.
Yeah. So how do you respond to that patient who says, I'm just tired of all of this. I want to go. I want to die. Why can't I die? How do you deal with that?
You're wondering why you're still here. And you just wish this were all over. Yeah. You know what I'm going to say? I, for one, am glad you're still here because you still have so much value. And this is hard. And I get it. It's really hard. I love that you're here for the moment. And if it turns out you aren't, I understand. But boy, am I glad you're here right now because I'm getting so much out of the time with you.
Okay. Once again, validate their feeling, confirm that you heard them. Okay. I get that. Yeah.
Yeah.
Boy, I have so much more I'd like to talk to you about, and maybe we can connect again in the future. I'd love to do another program with you along these lines. Before I let you go, though, tell me, You've seen all the research. I'm sure you've studied this intensely.
Yeah.
What have you changed in your life to minimize your risk?
I exercise. I do yoga. I try to eat decently. I wouldn't say I'm full out mind diet or Mediterranean. I deal with my distress, but I believe a little stress is decent for me as long as I know how to get out of it. And I try to engage with people I like to engage in and keep my mind learning and trying new things.
All good things. What do you see as the factors that are common in families who have successfully navigated this journey through dementia? What does my family need to have to succeed through all of this and not go after each other, as so many families do when you come to debate over care?
Yeah. The first thing is curiosity and a willingness to listen to each other and then keep the person that we're trying to support and care for front and center. But appreciate that all of us are probably in that moment doing the best we can, and be compassionate with one another and recognize if it's not happening, it's not happening. If I want more, I need to figure out where to go get that more for myself and not ask it of someone in the family who doesn't have it to offer, because all it does is build conflict.
Well, I appreciate our time together. There is so much more I want to talk to you about. So we'll connect in the future again. I hope you'll do that. All right. Thank you very much. You can learn more at teepasnow.com. That's teepasnow.com, her website. Great information there for caregivers about the training that Teepa has helped develop, and much more about Alzheimer's and dementia care for anyone walking this path. Teepa, thanks so much.
Thank you.